If you're in your 30s right now, I want you to hear this before your body starts changing, not after. Inflammation is the thing that makes perimenopause harder than it needs to be. And an anti-inflammatory way of eating, started now, is one of the single biggest things you can do to walk into this next chapter feeling steady instead of blindsided. Some women go through perimenopause with barely a symptom. That's not luck, that's preparation. Here's the problem with how we talk about perimenopause. Women are told to wait. Wait until your period gets weird. Wait until the hot flashes show up. Wait until it's undeniable. And by the time it's undeniable, you've often lost years you could have used to actually do something. To dig into this properly, I sat down with Dr. Robin Berzin, a Columbia-trained physician, functional medicine practitioner, and founder of Parsley Health, one of the country's leading functional medicine and longevity clinics. She has seen tens of thousands of women move through this exact gap, and she's spent her career proving that a huge amount of what we call aging, or just getting older, is actually reversible once you treat the real underlying causes. The time gap nobody talks about. Here's the biggest misunderstanding. Dr. Berzin sees walk through her clinic doors every single week. Women assume that because their cycle is still fairly regular, they can't possibly be in perimenopause yet. In their minds, perimenopause equals hot flashes, night sweats, and a period that's gone haywire. But those classic symptoms? They show up late in the game. The truth is, your hormones can start shifting up to 10 years before your final period, long before your cycle changes at all, long before the hot flashes arrive. And the symptoms during that earlier window often don't look hormonal at all. That's exactly why so many women get stuck, dismissed, and frustrated. They're told everything looks normal because the tests being run were never designed to catch this stage. Perimenopause doesn't begin the moment your period gets irregular. For many women, it begins around 35, quietly, in the background, while everything on the surface still looks fine. What it actually feels like, Dr. Berzin, is 44, still completely fertile, and still deep in perimenopause, both at once, which surprises people every time she says it. For her, and for so many women, it shows up as fragmented sleep, waking in the middle of the night for no clear reason. It shows up as stubborn weight gain that refuses to respond to the exact habits that used to work. It shows up as libido that shifts, and not always downward. Sometimes it surges before it dips. It can look like new anxiety or mood swings that feel out of character. It can even unmask ADHD for the first time in women who were never diagnosed as children, simply because that diagnosis was historically handed to boys almost exclusively. And it can trigger inflammation and autoimmune flare-ups that seem to come out of nowhere. The common thread underneath all of it, as progesterone quietly begins to decline and estrogen becomes more erratic, your body loses two protective mechanisms at once. You lose the foot on the gas that estrogen provides for your metabolism, and you lose the natural lid that progesterone keeps on inflammation and autoimmune activity. When both of those slip at the same time, things in the body start to shift, and conventional medicine, largely, isn't testing for any of it. This isn't just about symptoms, it's about your whole future. This is the part that deserves to be shouted from the rooftops. Perimenopause isn't just a phase to survive, it's a health span moment. This is when women start losing lean muscle and bone density at a faster rate. This is when risk quietly increases for heart disease, osteoporosis, dementia, and certain cancers. Treating this stage as something to just push through misses the real opportunity, sitting right in front of you. And here's the catch: waiting has a cost. You can't fully undo lost collagen or reclaim years of bone density loss just by starting hormone therapy later. Early action isn't a nice to have. It's the difference between managing symptoms and actually protecting your future self. Even women with almost no symptoms benefit enormously from building strength, eating in an anti-inflammatory way, and caring for gut health during this window. Because a strong foundation now shapes how smooth or how rocky the years ahead will be. HRT has a place, But it's not the whole story. Parsley Health has been prescribing hormone replacement therapy for a decade because the data supports it, plain and simple. Right now, only around 5% of women use HRT during perimenopause and menopause. Dr. Berzin believes that number should, and eventually will, flip toward 95% as we shift from a reactive mindset to a proactive one. But here's the honest truth. HRT will not build your muscles. It will not build your bones. It won't move the needle on your cardiovascular fitness or your heart rate variability on its own. You still have to lift the weights, do the sprints, jump on the rebounder. Hormones and lifestyle aren't competing strategies, they're partners. Skipping one to lean entirely on the other leaves real protection on the table. A strange and beautiful biological fact. Humans are one of only a couple of species, alongside whales, where females live long past their reproductive years. The leading theory is beautifully simple. We live on so we can mentor, teach, and guide the next generation. Menopause isn't a shutdown. It's a second chapter, written into our biology, on purpose. Reframing this stage from, I have to I get to, changes everything. Getting strong now isn't a chore. It's how you show up fully, at 70, 80, 90. Untangling perimenopause, from thyroid, adrenal, and blood sugar issues. So how do you tell hormones apart from thyroid dysfunction, adrenal burnout, or blood sugar problems? It starts with real testing, not the narrow handful of markers a standard checkup runs to catch late-stage disease, but a fuller map of thyroid function, sex hormones, and adrenal hormones like cortisol and DHEA. And critically, hormones need to be tracked over time, not caught in a single snapshot. A one-off progesterone test can look normal while still telling you nothing useful. Testing across several points in your cycle, or every few months over half a year, reveals the actual trend line, whether progesterone is quietly declining, whether estrogen is swinging unpredictably from one cycle to the next. Progesterone deserves special respect here. It's deeply anti-inflammatory, calming to the nervous system, and essential for good sleep. As it declines in perimenopause, the body loses one of its best natural defenses against inflammation and autoimmune activity. Right around the same time, estrogen starts behaving erratically. Testosterone matters too. Roughly 80% of women lose testosterone during this stage, while a smaller group, for reasons still not fully understood, seem to hold on to it well into their 70s. Layer chronic stress, an inflammatory diet, a sedentary routine, and everyday toxin exposure, on top of shifting hormones, and you get a system working much harder than it used to, just to stay balanced. What you can actually do at the doctor's office. You don't need to wait for a functional medicine clinic to start asking better questions. Ask directly. Has my full thyroid panel been run? Can we check my sex hormones, especially testosterone, estrogen, and progesterone, around 3/4 of the way through my cycle? Can we test fasting insulin alongside hemoglobin A1C, not just one or the other? At-home and direct-to-consumer lab panels have also become widely accessible and affordable, whether through a specialty clinic or standard diagnostic labs. Getting your own numbers, even without a full care team behind you, is a powerful starting point, as long as you follow it with real guidance, not just a report you don't know what to do with. Why stress hits harder than you think? Stress isn't just in your head. It's a full-body event, and it collides directly with your hormones. When cortisol rises under stress, blood sugar rises with it. Insulin follows to bring that blood sugar back down, and rising insulin nudges testosterone upward, which then gets converted into estrogen through an enzyme called aromatase, accelerated even further under chronic stress. The result is a cascade. Chronic stress doesn't just make you feel frazzled, it physically reshapes your hormone balance, often showing up as abdominal weight gain, rising visceral fat, and gradual loss of muscle and bone. This is why the scale is one of the least useful tools you own. A full-body DEXA scan that measures muscle mass, bone density, and visceral fat tells a far more honest story about your health than any number on a bathroom scale ever will. The estrogen-dopamine connection. One of the most underappreciated links in this whole picture is between estrogen and dopamine, your brain's reward and focus center. As estrogen declines, dopamine regulation can suffer right along with it, which is part of why ADHD so often reveals itself for the first time in midlife. What gets labeled brain fog is frequently something more specific: scattered attention, sudden forgetfulness, and difficulty holding focus. Not a fog, but a short circuit. 3 things help meaningfully: consistent sleep and wake times, strongly linked to longevity; regular movement, even short, exercise snacks, like a 5-minute walk or a set of squats between meetings; and, where appropriate, low-dose estrogen support under a provider's guidance. Building support in layers, not all at once. The smartest approach isn't going from 0 to full hormone therapy overnight. It's layering support gradually, starting with foundational supplements that address specific shifts, moving to something like cyclic topical progesterone in the second half of the cycle if signs like mild hormonal skin changes appear, and eventually progressing toward vaginal or oral progesterone as levels drop further. Introducing hormone support too early or too aggressively often causes more symptoms, not fewer: bloating, mood shifts, fluid retention. Match the tool to where your body actually is. Motherhood in the middle of it all. Because more women are having children later, an entire generation is now raising young kids while deep in perimenopause. That's a real emotional tension. The rigid, hyper-optimized daily routines you see in wellness spaces simply don't survive contact with a toddler or a newborn feeding schedule. But there's a hidden upside too. Pregnancy hormones, postpartum oxytocin, prolactin. The biology of mothering may quietly support long-term health in ways research still hasn't fully mapped. Necessity becomes the driver of better habits. Sleep, movement, lower inflammation. These stop being optional wellness extras and become survival tools for showing up as a present parent and partner. A real daily routine, not a perfect one. 15 minutes of morning meditation. Protein-first meals to steady blood sugar. Intermittent fasting most days, not every day. Weight training 2 to 3 times a week after an unexpected osteopenia diagnosis triggered a real wake-up call. Pilates and yoga for core and mobility. Short bursts of high-intensity movement instead of long cardio sessions. Daily walking wherever possible. Magnesium, vitamin D3, K2, targeted bone support supplements, a mitochondrial support supplement, an immune-supporting mushroom blend, omega-3s, and cyclic topical progesterone, taken consistently, at whatever time of day actually gets remembered, because consistency beats precision every time. The rapid-fire truth. The symptom most often dismissed as just stress. Waking at 3 a.m., the lab marker most doctors skip. Inflammatory markers like hsCRP, the lifestyle factor that worsens symptoms most. Alcohol. The research-backed truth worth knowing. Vaginal estrogen benefits the vast majority of women over 50. The best thing you can do for long-term brain health: keep your blood sugar markers in check and lift weights. And the biggest lie ever told about perimenopause, that it's all in your head. It never was. It was always in your body. And now you know exactly where to start looking.